Hi, I am Meredith Molhusen, and I am a junior in animal science pre-veterinary medicine, and I am here to talk to you about the uses of blood plasma transfusions in the equine industry. What is a blood plasma transfusion? Well, it's an injection of blood from one person or animal into the bloodstream of another. And usually how it occurs with equine is that there will be a donor, and this donor will usually fill up a bag of their blood plasma, and then it'll be frozen and saved for a later date for usually a foal or an immunocompromised adult animal, and you will thaw that and transfer it into the blood system of the immunocompromised animal by intravenous injection. These transfusions are usually used for treating an immunocompromised foal with the adult equine plasma, and the definition of immunocompromised is having an impaired immune system. You can use these transfusions to treat and prevent horses from a multitude of diseases, and these transfusions usually are used to increase the number of immunoglobulins, plasma protein, neutrophils, procoagulants, platelets, fibronectin, and enhance phagocytic capacity. In these next two figures, I wanted to show how a foal can be administered the blood plasma transfusion from the adult donor. Transfusing the adult plasma into a foal allows the benefits that I previously stated to occur. The adult donor has a much stronger immune system, which is why they are great donors and will provide the benefits to the foal. As shown in the left figure, where you can follow my mouse, this is the bag of blood plasma, and if you follow the line down, it is connected to the foal where it is being transfused into the blood system of the foal. And in the right picture, it's basically the same thing happening. It just looks a little bit different with the foal standing up, and the mare is right next to the foal. Why do the foals need these blood plasma transfusions? Well, they want to be improving their early health development, and in order to do that, you need to increase their antibody levels. And in order for the foal or an older immunocompromised horse to increase these antibody levels, it usually needs to happen via blood plasma transfusion. And these transfusions are able to help the foals attain the strong immune system, and many may have not had the opportunity to suckle on mares for their colostrum long enough to attain all the antibodies from their mom for a strong immune system. So that's one of the major reasons why these foals need a blood plasma transfusion. And also a failure to receive all the antibodies from the mare will cause the foal to have this poor immune system and decline in health rapidly. Possible donors of blood plasma, it's commonly adult horses that have a strong immunity and healthy levels of all the following: the immunoglobulins, plasma protein, neutrophils, procoagulants, platelets, fibronectin, and phagocytic capacity. So as long as they have high levels of all of these, they should be a great advocate for donating blood plasma. Why is increasing phagocytic capacity important to foals? It is important because the foal will now be able to fight off diseases. Phagocytes are usually used to attack foreign cells in the body and kill them. Opsonizing, which means to kill these foreign cells. They usually opsonize bacteria and viruses that cause the foal to, and by killing these, it'll cause the foal to gain immunity and improve resistance to many diseases. And in a study performed by Grandal, Johannesson, and Jensen-Warren, they concluded that foals have significantly lower opsonic capacity than that of adult horses. By transfusing this adult plasma into the foal within the first 2 weeks of life, it will allow the foal to attain the level of immunity that an adult horse usually only has. And by attaining this, the neutrophil functions will increase dramatically, and also the immune health reaches the optimal levels. Blood plasma transfusions are usually used to treat many diseases, especially colitis. What colitis is it is an illness that will affect any age or breed of horse, and it is normally associated with inflamed colonic mucosa and follows with diarrhea. The symptoms of colitis can cause an affected horse to deteriorate in health rapidly, which is why these blood plasma transfusions are so important and so needed to have right on hand in order to treat a foal. And treatment occurs intravenously via blood plasma transfusions. These blood plasma transfusions are rapid and effective. They're an effective way to fight against colitis and prevent a multitude of other diseases by passive immunization. Other than colitis, these blood plasma transfusions are also useful to treat tetanus, rotococcal pneumonia, West Nile fever, and botulism. In the following figures 3 and 4, these are examples of what bags of plasma look like that are used to treat colitis. And on the left is a frozen bag that would just need to be thawed and warmed up to room temperature, body temperature of the foal. And on the right, it's just the same thing, but a different brand and a different size of bags that are used to hold the plasma. In another study conducted by R.P. Atherton on colitis, he had the purpose was to find which symptoms of colitis were most improved after multiple horses with colitis were transfused with hyperimmunized antidiarrheal plasma. And the reason they would transfuse them with hyperimmunized antidiarrheal plasma was because this type of plasma is important since the major cause and symptom of colitis is major diarrhea. And diarrhea will cause the animal to lose a lot of nutrients and water out of their system. The results of this study is a significant decrease in diarrhea and a full recovery and a decrease in respiratory and heart rates. So that means that the study proves that blood plasma transfusions not only work to help foals improve their immunity, but it also helps cure and prevent diseases in adult horses. The risks of blood plasma transfusions are minute, but although there are some, a transfusion reaction is a major concern when performing these transfusions. A study performed by L.Y. Hartfelt and colleagues tested how often transfusion reactions occurred in neonatal foals between 7 to 30 days of age and adults over 30 days of age. Findings is what they found for the neonatal foals to have a reaction was 9.7% and an instance of 0% in both foals older than 7 days. So basically the only way you're going to find a transfusion reaction is if the foal is less than a week old. Also, all the transfusion reactions observed were mild and there were no mortalities found. So one can conclude that the chances of a transfusion reaction is minimal, and if there is a reaction, the likelihood of the foal passing is almost zero. Overall benefits of treating foals with blood plasma transfusion is this procedure allows equine owners to have a safe neonatal foal and any horse that contracts colitis or other immunocompromising diseases. Without this opportunity to use blood plasma transfusions, the occurrence of neonatal deaths would rise substantially, and the future would be very different without this blood plasma transfusion discovery. And so the future is bright with opportunities when using blood plasma transfusions, not only in the equine industry, but expansion into other industries in animal agriculture. This is my bibliography that I used to find all of this information in my paper and in my PowerPoint. Thank you.